Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about cystitis. In particular, I will cover what it is, how you treat it, and how you can more successfully live with symptoms. So we start with what is it? Cystitis is inflammation of the bladder, usually caused by a bladder infection. It's a common type of urinary tract infection, particularly in women, and is usually more of a nuisance than a cause for serious concern. Mild cases will often get better by themselves within a few days. However, some people experience episodes of cystitis frequently and may need regular or long-term treatment. There's also a chance that cystitis could lead to a more serious kidney infection in some cases. So it's important to seek medical advice if your symptoms don't improve. So the main symptoms of cystitis include pain, burning or stinging when you go to the toilet, needing to pee more often and urgently than normal, and urine that's dark, cloudy or strong smelling, and pain low down in your tummy, feeling generally unwell, achy, sick and tired. So what causes cystitis? Most cases are thought to occur when bacteria that live harmlessly in the bowel or on the skin get into the bladder through the urethra. So that's the tube that carries urine out of your body. It's not always clear how this happens, but it can be caused by having sex, wiping your bottom after going to the toilet, particularly if you wipe from back to front, inserting a tampon or urinary catheter, and using a diaphragm for contraception. Women may get cystitis more often than men because their back passage is closer to their urethra, and the urethra is much shorter, which means bacteria may be able to get into the bladder more easily. So there are a number of things that can increase your chances of developing an infection in your bladder. If you're unable to empty your bladder fully, any bacteria that get inside may not be flushed out when you go to the toilet and can multiply more easily. You may not be able to empty your bladder fully if you have blockage in your urinary system, such as a bladder stone, you're pregnant, as the baby may be pressing on your bladder, and in men, you may have enlarged prostate gland that presses on the urethra. And so in the menopause, for women who have been through the menopause or are going through it, the lining of the urethra can shrink and become thinner because of a lack of the hormone estrogen. The natural balance of bacteria in the vagina may also change, which can potentially allow harmful bacteria to become more common. This can make the urethra more vulnerable to infection, which could spread into the bladder. Next would be for diabetes. You're more likely to get cystitis if you have diabetes, which is a condition where your level of sugar in your body becomes too high. Other causes of cystitis would be caused by damage or irritation to the urethra and bladder. This can be the result of friction from sex, chemical irritants such as those in perfume soap or bubble bath, and damage caused by a catheter or surgery on your bladder, radiotherapy to your pelvis, or treatment with certain chemotherapy medicines. So how do you treat cystitis? If you see your GP with cystitis, you'll usually be prescribed antibiotics to treat the infection. These should start to have an effect within a day or two. If you've had cystitis before and don't feel you need to see your GP, you may want to treat your symptoms at home. Until you're feeling well, it may help to take paracetamol or ibuprofen, drink plenty of water, hold a hot water bottle on your tummy or between your thighs, avoid having sex. Some people find it helpful to try over-the-counter products that reduce the acidity of the urine, such as sodium bicarbonate or potassium citrate. But there's a lack of evidence to suggest that they're effective. If you keep getting cystitis, your GP may prescribe a low-dose antibiotic for you to take continuously over several months. If cystitis keeps coming back, and this is known as recurrent cystitis, your doctor may prescribe standby antibiotics or continuous antibiotics. A standby antibiotic is a prescription you can take to a pharmacy the next time you have symptoms of the cystitis without needing to visit your GP first. Continuous antibiotics are taken for several months to prevent further episodes of cystitis. and these may be prescribed. So if cystitis usually occurs after having sex, you may be given a prescription for antibiotics to take within 2 hours of having sex. If cystitis is not related to having sex, you may need or may be given a low-dose antibiotic to take for a trial period of 6 months. So how do you live with the symptoms of cystitis? If you get cystitis frequently, there are some things you can try that may stop it coming back. However, it's not clear how effective most of these measures are. And these measures include not using perfumed bubble bath, soap, or talcum powder around your genitals. Instead, use plain unperfumed varieties rather than a bath that this avoids exposing your genitals to the chemicals in the cleaning products for too long. Going to the toilet as soon as you need to go, and always empty your bladder fully. Staying well hydrated, drink plenty of fluids, may help to stop bacteria multiplying in your bladder. Always wiping your bum from front to back when you go to the toilet, and emptying your bladder as soon as possible after having sex. Wearing underwear made of cotton rather than synthetic material such as nylon, and not wearing tight jeans and trousers. Drinking cranberry juice has traditionally been recommended as a way of reducing your chances of getting cystitis. So finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing cystitis more effectively. So we've supplements and products which you can purchase from us without a prescription, such as paracetamol, Nurofen, cranberry capsules, cystipurin, and a Caniston range of products such as creams and pessaries and Canis Balance. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a clinic, we co-create a management plan which enables you to take a more active role in managing your illness with confidence. So we provide you with the tools you need to live a healthy life. So call into us at Lynch's Pharmacy in Douglas, in Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.